Hello, I'm Kimberley Egonmwan, an attorney and also co-host of the afternoon show of WVON 1690 AM, The Talk of Chicago. And I'm so pleased to be here with you on a new show called Counterpoint. It's a program in which we take experts who've got differing opinions on the same topic and we let them have a discussion with us. We never shy away from the difficult discussions, and we never tell you what or how to think. We just give you the best information available and we allow you to make your own decision. So we want to thank you so much for joining us today. It's one of the most important decisions that people are facing today, and it's COVID-19, to vaccinate or not to vaccinate. The 2-dose vaccines, which are offered by Pfizer and Moderna, and also the one and done offered by Johnson & Johnson, they've been available for several months now, and they are all touting safety and high effectiveness. But from trying to understand how the vaccines work, how they're being offered equitably among different racial groups, and also how safe the vaccines really are, tonight we're going to get to the bottom of that about COVID-19 vaccines. And there are many reports that we have done on CBS 2 on this issue. Joining us tonight, we are so happy to have with us two extremely special guests. Dr. Tara Kirk. Of course, she is a senior scholar at the Johns Hopkins Center for Health Security and an assistant professor in the Department of Environmental Health and Engineering at the Johns Hopkins Bloomberg School of Public Health, where she conducts, manages, and leads research projects to develop a greater understanding of potentially large-scale health events. She focuses on improving public health policy and practice in order to reduce the health impacts of disasters and terrorism. We want to welcome Dr. Sell to our first show.
Thanks for having me.
Thank you. Also joining us on Counterpoint, she is the foremost authority on COVID-19 in the third largest county, second largest medical center in the United States, county in the United States. She's led the effort to mitigate the impact of COVID-19 on Cook County, and she serves as the co-lead of the Cook County Department of Public Health. We are so pleased now to be joined by Dr. Rachel Rubin. Welcome.
Thank you so much for having me this evening, and I'm so happy to join Dr. Zell as well.
Thank you. Now, COVID-19 seemingly came out of nowhere, and when it hit hard. Dr. Sell, I know that you have studied everything from terrorism to pandemics and natural disasters. So we want to know, in your opinion, this vaccine is free. We have 3 different versions right now that are available in the United States. Yet, over 50% of Americans at this point still have not been vaccinated. Why aren't people rushing to get this vaccine?
Well, I think that there are a number of different reasons why people can choose not to be vaccinated. In some cases, it's accessibility, where they have, maybe they have something else that they're busy with, or a hard time getting a ride or a schedule to get to a vaccine. And in other cases, it's more of a hesitancy. They have questions about the vaccine that they haven't had answers. Maybe they don't trust vaccines. They don't trust pharmaceutical companies. But it can be a range of different reasons. And I think we're at the point where we're kind of having to go through these one by one and get to people. And it's not that low-hanging fruit anymore of people who are just waiting and waiting to get the vaccine, and now they got a chance, they're going to go get it. Now we have to go convince people.
So, Dr. Sell, you mentioned this idea of lack of access. Is that real, or is that still perceived? I mean, is there still a real lack of access now that we're so many months in?
Well, so many people have had the chance to get the vaccine, but at the same time, if people are working multiple jobs, if they have a schedule they can't plan ahead on, if they have a hard time getting a ride to a location, these types of things can be barriers, especially if you think, well, I'll just get it tomorrow, or I'll just get it, next week. There's no urgency behind it. That can be sort of a reason why people just don't go out and get it. That's why some of these incentive programs have actually really helped, because they give people a deadline to go out and get their vaccine, a reason to actually schedule it and get it done. Some states are doing lotteries, some states are doing giveaways, providing different bonuses or nudges, things that remind people that, oh yeah, I'll go out and do it. And these types of things have been helpful, but of course you want to be careful that it's not, too big of a, something that's going to push people in the opposite way, thinking that it's coercive or something like that.
You know, we still have a significant number of people who remain unvaccinated for a multitude of reasons. But I want to ask you, even though there are people who are unvaccinated, the numbers of people who are actually getting COVID-19 as well as people who are dying who have been exposed to COVID-19 have drastically dropped. What is the reason for that, Dr. Rubin?
Well, the main reason is indeed vaccination. But we have to put that in perspective. Overall, in suburban Cook County, which is my catchment area, we are at about the state average. So one vaccine, so at least they're partially immune and they're on their way to getting the second vaccination and that extra 2 weeks of time after that second shot or after the Johnson & Johnson for you to be completely immune. But that isn't talking about all of our communities within the suburban area or within the state. So there are specific geographic regions as well as within specific age ranges and races and ethnicities that have lower rates than that or that have higher rates than that. For example, the 70 and 80-year-olds in suburban Cook have over 90% completed both vaccines. And in part, that has to do with a big push out for that age group, especially those who initially were in nursing homes and assisted living, but then also in independent living. That was the first group to sort of open up after healthcare workers and certain first responders were vaccinated, were those above the age of 60. So they have really taken the vaccine up and we have brought the vaccine to them where they live. Then it opened up to different age groups, those with underlying medical conditions of any age. And that took some time to get through them. And then for people that have underlying medical conditions, they certainly feel the pressure and the importance, maybe more than younger people that are healthy, to get the vaccine. And so they are, and also have had higher than that 50% uptake so far. But then we get to the 20-year-olds, the 30-year-olds, the young 40-year-olds, and we find, as well as now even in the younger age groups, which of course can't be vaccinated if you're under 12, and you see that they have lower vaccination uptake, and these are also the decades of life of individuals that drove this last wave that we now have finally gone past, and now our numbers are very low. We're going to have a pocket more positive cases in those areas that have the least vaccine coverage, and then it's going to end up spreading again.
Well, you know, even after this past year, there are still some Americans who don't see COVID-19 as a threat. There's still some who see it as not a major threat. How do you counteract something like that?
Well, yeah, that can be really difficult, especially as we realize how politicized the pandemic has been, and how we have, this swirl of mis and disinformation that make it so that people, are surrounded by narratives with multiple different, lies or misleading information that makes it so that they're convinced that they're being tricked or something. Right. And so this can be, often we see the most hesitancy right now with younger people because they don't see the same risks as older people. We know that COVID-19 affects older people much more severely. And so it's based on that. We also see a lot of hesitancy with rural residents or white evangelicals, Republicans. This is information from the Kaiser Family Foundation polling. And so these groups, have a little bit more hesitation, or perhaps they have feel like they have less of a reason why they need to go out and go get it.
You're watching Counterpoint on CBS in Chicago. I'm Kimberley Egonmwan, and we'll have much more on the vaccine debate right after the break. You're watching Counterpoint on CBS in Chicago. Joining us now are two women who are part of a historic lawsuit in the state of Texas. Houston Methodist Hospital decided to make the COVID-19 vaccines mandatory for their staff. They did that in April, and there was a group of about 117 personnel who decided that they were not going to take that vaccine and that they were going to file a lawsuit. They did so on May 28th. They were given until June 7th to take the vaccine. Otherwise, they would go on a 2-week unpaid suspension. Joining me right now are Latricia Blank. She is an ultrasound technologist at Houston Methodist Hospital, as well as Jennifer Bridges, who is the lead complainant on the lawsuit against Houston Methodist Hospital. Ladies, I want to thank you so much for joining us today on Counterpoint.
Thank you.
Thank you.
So let's talk about this really quickly. From what I understand, the hospital was told that they had to get the COVID-19 vaccines in April. So Jennifer, when they told you this, you decided for what reason that you were not going to get the vaccine? Tell us.
At that current moment, I just wanted more information. I wanted more research. I wanted it fully FDA approved. And I noticed all my colleagues were wanting the same thing. So I just started advocating for him. And the next thing you knew, it turned into something so much bigger than that. Initially, I had a very small battle. I was just dealing with my CNO and CEO. I was trying to kind of reason with them, trying to negotiate. They weren't having it. So then I started contacting the media, which led to an online petition, which led to a lot more media, and then onto the lawsuit.
Is it just this particular vaccine? Have you vaccinated your family? You know, there are many vaccines that are out there that have to be taken by children in particular. First, you, Latricia, did you get other vaccines, or are you what they would call an anti-vaxxer?
I have always gotten other vaccines.
How about you, Jennifer?
No, I'm definitely not anti-vax. I've taken all my vaccines throughout childhood, and even the flu one, because Methodist mandated that one too. But this one is very different. With my own eyes now, I've seen hundreds of patients and employees that have taken the shot and within a few days just come down with severe adverse reactions. And no one's talking about it or addressing it. And it's very scary that the public's just not aware of what's really going on with it.
Because it's a hospital and it's a clinic, it is the one place, if the vaccine were to be mandated, I would think that it would be a hospital or a clinic, because you know when people come there, they're coming with an illness. That hasn't persuaded you at all to take the vaccine?
Not me, no, it hasn't. I dealt with COVID all last year. I was on the front line with COVID. I caught it from my patient. This whole time we've been fully prepared with our PPE. We've done proper hand hygiene. We're really educated and trained to know how to protect our patients from catching anything from us. So we weren't vaccinated all last year and everything was okay. This is nothing different. We could still wear that PPE and be perfectly fine, and we're not going to spread anything to anybody.
Yeah, because that's the concern of a lot of people, this idea of going to a hospital and receiving it from a healthcare worker, because you are around so many people. So let's move forward to this idea of, we've just surpassed 600,000 people who have died from COVID-19. But what we have seen, what the doctors have said, is that the number of COVID patients has decreased dramatically because of the vaccines, but that still isn't persuasive.
No, ma'am.
No.
No. Yeah, well, going back to the CDC, it does not say anywhere that if you are vaccinated, you will no longer spread it. And it does not say that if you are vaccinated, that you will no longer get it.
But the one thing it seems to do is reduce the chance of dying from it. So, even right now, all of the data that's coming out is that if people are vaccinated, they may get it, but they will not die. They're not getting more cases in the hospital. As a matter of fact, the cases that they're getting in the hospital, according to the latest data that I've seen, are people who have not been vaccinated.
I don't agree with a lot of that research because I've seen a lot with my own eyes. And then on top of it, the numbers lately have dramatically reduced, but I do not credit it to the vaccine. Millions and millions of people have already had COVID. So at the same time this vaccine was coming out and being introduced, it had already created such a herd natural immunity.
But let me ask you this. You have gone to the wall with this. The lawsuit that you filed, it did get thrown out, but from what I understand, you all will be appealing. Is that correct?
Yes, ma'am. We've already filed an appeal in the Fifth Circuit Court of Appeals. So now it's just a waiting game, because they're going to put in their side, we'll put in ours, and then the courts will let us know when we'll have our hearing date. But my lawyers already told me that most likely this will end up going up to the Supreme Court level, because it is such a big case that's going to basically set the precedence of the rest of the nation.
Were you willing to get regular COVID testing in lieu of taking the vaccine?
I would.
Was
It
that
would be
an option?
uncomfortable, but I would.
Was that an option?
There was no option. They gave us zero option. I met with my CNO and CEO back in April before they mandated it to try to compromise, just to come with some negotiation that we could wear N95s and face shields and anything, and they would not hear it. They wouldn't address to any concerns. My CEO literally told me, he said 100% vaccination is more important than y'all's individual autonomy.
And so from what I understand, Houston Methodist is the first hospital in that area to make this mandatory. University of Illinois, which is the flagship school for the University for the state of Illinois, has mandated COVID vaccines, but with the option of being tested regularly if you do not take the vaccines. There are some people who cannot take the vaccine. So we're going to see if this is a trend. I want to thank you ladies so much for joining me today. We're going to keep watching. It'll be very interesting to see how it turns out, as well as what the implications are for some of the other things that are very similar to this in nature.
Thank you very much.
You're watching Counterpoint on CBS in Chicago. I'm Kimberley Egonmwan, and we'll have much more on the vaccine debate right after the break. You're watching Counterpoint on CBS in Chicago. When we're talking about the actual vaccine, do you see a large percentage of people who don't want to get it just because they're kind of concerned about any side effects? From what we understand, that there can be some side effects with taking the vaccine.
Yeah, so there are about as time has gone on, we've gotten more people who were in the wait and see category. They have been vaccinated, but we have a sort of a stubborn 20% of people who are a little bit more vaccine hesitant and that really hasn't changed. So, if we think about why people are vaccine hesitant, many are concerned about those potential side effects. Some people can't afford to miss a day of work. And so this is something that can be a barrier, even if you're open to getting the vaccine, this has to do with income. Some people are worried about the speed of the vaccine development. They are worried about sort of historical medical mistakes, or they're just, think they don't need it, or they have, they never get vaccines. So it can be a range of different reasons here, but the side effects, the concern about that does seem to be a major reason. And, it's based on the fact that there can be some side effects, although generally these are mild and go away within 24 hours.
So when Johnson & Johnson was introduced, of course, and sometime there was a very rare blood clot that was associated with it. Several women of a certain age range, they suffered from these blood clots. Do you think that set us back at all, or was it just such a minuscule number of people that didn't have that much of an impact?
I think it set us back with regard to the Johnson & Johnson vaccine, but fortunately we have other vaccines that people can choose from, especially in that younger age group for women. I think though the important thing to know here, and that kind of should be marks on the side of regulators to say this was a very rare occurrence, and we saw a safety signal, or the FDA, CDC saw a safety signal and said something about it, and we're willing to take the hit. And this isn't a machine that's just going to roll over no matter what kind of safety signals we see. When there's a safety signal, something is done about it. And so I think that people can feel more confident that, if something were going on, if there were really significant safety signals, there would be, the CDC and FDA would, look into that and make sure that it wasn't a big deal. And if it was, they'd call it. And I think we saw that with Johnson & Johnson.
So when we're talking about these three vaccines, of course, we've got the Pfizer, we've got the Moderna. Those are both the 2-dose shots. They have a different way of fighting the virus, as opposed to Johnson & Johnson. Is one better than the other?
What we've been saying from the very beginning, the best vaccine is the one that you can get soonest, the one that is offered to you. Take the first one that's offered to you. Now, the Pfizer is the only one right now that is authorized for use for 12-year-olds and above. The other two are for 18-year-olds and above. So we want to get our younger people vaccinated, so they will have to take the Pfizer. But the other vaccines are also great for anybody above the age of 18. Some people prefer the Johnson & Johnson because it's, as I say, it's one and done.
Mhm.
One shot, you're fully vaccinated. After 2 weeks, you don't need to come back for a second shot. But other people prefer the 2 shots. And what we've been able to do now that we have enough vaccine to go around for anybody that wants it is that we're giving people choice. So people can get, not maybe in every single vaccination center, but within a short distance away, you can choose and get whichever type of vaccine you so choose.
You know, from almost the beginning of this pandemic, it became apparent very quickly that African Americans in particular were disproportionately impacted by this disease. First, at the rates at which African Americans got the disease, but then the deaths, the rate of death in the African American community far exceeded the other groups. Is it that African Americans are the only ones not getting the vaccine?
No, of course not. There are many different groups that aren't getting the vaccine that are worried for a variety of reasons, and sometimes the same reasons. I do think African Americans have seen some history in which they can rightly question the medical community, and I think that this requires conversations and trust. Mm-hmm. It requires, if people are hesitant that there are trusted community members, there's work done that people understand that there's nothing weird going on here. This is about trying to prevent people from getting the disease that could kill them. And so I think that, there's a lot of different things going on with a lot of different populations, but I wouldn't say one population has one specific reason why they're hesitant.
Right. It just seems to be that there's such a focus on almost to the point of shaming, that it feels sometimes as though it's a highlight on African Americans not receiving the vaccine. But I've heard of many people in the military not receiving the vaccine, even some doctors at hospitals and medical staff and police officers that aren't necessarily all African American. I appreciated the fact that you said that there are many different groups and there are different reasons for the hesitancy. What would you say would be also another way in order to combat that? Because you mentioned lack of trust. It's in many cases, not all, it comes down to a lack of trust.
Right. Well, I think at this point, it's really about getting into the communities, talking to people, listening, responding to what we hear. Dr. Rubin can probably speak more to this because she's doing it herself. But making sure that we understand the reasons why people are being hesitant. Many people have their own stories and they have their own conversations. We need to arm people who are family members, who are community leaders, religious leaders, pillars of the community with the information they need to have these conversations. And sometimes it's going to be one-on-one. And, it's going to be a slow process from this point on. We're not going to have the same, exponential gains we had really early on. But it's important work. It's good work. It's going to require the help of the community.
There is a term that has been misused, but also used a lot, and it's the term herd immunity.
2 things about herd immunity. First of all, what is it? And what herd immunity is when a certain percentage of the population is vaccinated, the virus itself is not circulating. We don't have what we call community spread of the virus in the community, that there are a lot of positive people that are still sort of spreading it around to other unvaccinated individuals, and even to some vaccinated people who will generally get a mild disease from it. So the more people you get vaccinated, the lower level of circulation of the virus in the community. The second point, though, is that herd immunity doesn't mean 70 or 80% average in a large geographic area, like 70 to 80% in the state of Illinois. It means 70 to 80% in every single community and subgroup throughout the state and throughout the country.
And that's the trick.
And ultimately really throughout the world, right?
Yeah.
Coming up on Counterpoint.
I think that we have to be compassionate and understand why certain people may not be vaccinated, but to slowly inch them along and try to address people's concerns.
You're watching Counterpoint on CBS in Chicago. There's still going to be a category of people that we really don't talk about a lot that cannot get the vaccine for one reason or another. What precautions do they take? You know, I know definitely masking and, you know, staying away from people, et cetera, but what solace is there for a person who can't get vaccinated?
Most restrictions are being lifted, which means that there aren't going to be any occupancy limits inside facilities and particular retail establishments, restaurants. I mean, of course, the limits are what's allowed by the fire code, but not any restrictions based on what's been there prior related to COVID. However, the masking guidance is still going to be in place, which means that if you've been vaccinated, you're good to go. If you've been vaccinated, you can go into most places and you don't need to have your mask on. You can go to a wedding and not have your mask on. There are certain places that everybody still has to have masks on, such as airports and schools and congregate settings, long-term care facilities, prisons, homeless shelters, these places that are very high risk. However, otherwise, if you've been vaccinated, you don't have to have your mask on. If you haven't been vaccinated, you need to have a mask on. And for those people that are immune compromised or are allergic, have other reasons where they cannot take a vaccine, or even if they have the vaccine, they can't mount an immune response, they need to wear a mask. But it also means that it's really a community and a societal responsibility for anybody that chooses not to be vaccinated to wear a mask and to maintain a 6-foot physical distancing, because then it protects the rest of us who cannot get vaccinated or cannot mount an immune response.
Well, you know, this question is for both of you because you brought up a very interesting point. There are events and initiatives now for people to be vaccinated. But do you foresee us, because things are opening up, ready or not, things are opening up, right? Do you foresee businesses, jobs, airports making vaccines mandatory? And then how do we deal with that if there are people who still will not get vaccinated? Dr. Rubin?
Yeah, certainly like, for example, my daughter's a college student, and to go back to in-person learning in the fall, she has to be vaccinated. Now, she has been vaccinated. Knowing who her mother is, she was going to get vaccinated. Yeah. But yes, her school is requiring that all students that are going to be studying on campus have to be vaccinated. Otherwise, you don't go to school. At least you don't, or at least you have to just continue to study virtually. Local establishments can set their own rules as long as they're more stringent than what the state recommends or what puts in place, which means that they can require saying, we're not going to trust or check everybody that walks into a restaurant or to a wedding or to an event that you've been vaccinated or not. So that means everybody's going to have to mask. And that's perfectly fine. And so I imagine that there are going to be some establishments that are going to continue to require masking. And then there are others that are going to say, you can't buy a ticket unless you prove that you've been vaccinated. And there are going to be some people that are going to slip through, but hopefully not very many.
You brought up the CDC requirements, or that, you know, saying the new guidance that says that vaccinated people don't have to wear a mask. And now, you know, people are all thrown off and thinking, well, what does this mean for everyone else? Well, I'll just give you an example. I think that we should be able to hold two things in our heads at the same time. One, that if you're a vaccinated person, you can be safe inside. But also, two, that some places, businesses, especially those that are high risk, will ask everyone to wear a mask because that's what is needed to make sure that the situation is safe. Here's the example. So I'm a former Olympic swimmer. I can swim. But when I go out on a boat, the law says that I have to bring a life jacket because that's what's necessary to make sure that, you know, we don't have all these deaths out on the water. I bring a life jacket. It's not a problem for me. And so I think that people need to understand that in some cases, you know, we're going to have to require masks in situations to make sure everyone's safe. And in those situations, I think that, you know, most people, you know, I think are fairly civic minded, and a mask is not a big deal. I mean, I just, you know, like, so when I go to the store, I'm vaccinated, I still wear my mask. just because, it's kind of just easier to do and easier to have everyone agree that we're going to try to keep everyone safe. I think everyone benefits from getting these last holdouts into being vaccinated. I don't begrudge, someone getting $100 gift certificate or whatever. I'm just happy I got my vaccine, and I'm happy they're going to get their vaccine.
And I completely agree. If it takes somebody getting a Great America ticket or being able to enter the lottery or, whatever other incentive they may get, a free t-shirt, that's fine. So let them have it. I'm not upset that I wasn't able to partake of that offer because as Dr. Zell said, it means that I've been safe. I think that we have to be compassionate and understand why certain people may not be vaccinated, but to slowly inch them along and try to address people's concerns and to be safe, because you're not just protecting yourself when you get vaccinated, you're protecting your family, your neighbors, your community.
When people choose to be vaccinated, they're protecting not only themselves, and not only giving themselves the convenience of not having to get sick, be in quarantine, have to have their kids not go to school or whatever, but they're also protecting their community, the people they love. For those who can't be vaccinated, the biggest protection for them is to be surrounded by people who are vaccinated. And so this is something that we can do for, everyone in our community. And I think that that's important.
That was a fabulous analogy. And I would not have expected anything less. Thank you so much, Dr. Tara Kirk and Dr. Rachel Rubin, for taking this maiden voyage with me on our very first show on Counterpoint. We really appreciate both of you powerful women. Thank you so much. And we want to thank everyone for watching. We hope you enjoyed it. We hope that you will go to Twitter and take the poll, CBS Chicago, on whether you are vaccinated or if you will be vaccinated. I'm Kimberley Egonmwan, and until next time, thank you so much.